In this video we are going to show you a session of SOUCHARD Global Active Stretching GAS for the close posterior kinetic chain self-stretching posture. These self-postures do not require a focus on the positions of the arms that remain in a neutral position, long by sides. The posterior chain muscles are the spinals that origin from the base of the skull to the lumbar sacral aponeuroses, the gluteal muscles, the pelvic trochanteric muscles, the ischiocrural muscles, the popliteus, the triceps surae, the tibialis posterior, and the plantar muscles. Lying supine on the floor, comfortably, with the ischial tuberosity touching the wall. The knees are flexed, without feeling any tension on the ischiocrural muscles, while plantar feet touching each other. The thighs are abducted with the knees as the same with of the hip. If you notice as the pic shows, that you are not able to keep the hip in contact with the floor, try to flex the knees a bit and reduce the tension. If this is not possible, you must move away from the wall. Another important element to be considered is the comfort of the head and the neck. If you notice that your head or neck are hyperextended, a few wedges should be placed under the head to keep the neck in neutral. We begin with the breathing sequence number 1 and number 2. I'd like to remind you that the postures in close kinetic chain don't require the breathing sequence number 3. This breathing sequence number 3 is only practiced during the self-stretching for the open kinetic chain. We begin with the breathing sequence number 1. Place your hand over the sternum, and be sure that the hand is parallel to the clavicles. Begin by breathing with pursed lips effortlessly and exhale while the hand is supporting the exhalation, lowering the chest down. After exhalating, hold your breath for a count of 3. 1, 2, 3, and then inhale without any effort. Repeat again by breathing with pursed lips, and after an exhalation, hold your breath for a count of 3. 1, 2, 3. Repeat few times, until you feel loosening of the upper cage, first 6 ribs. During this procedure, there is no need to worry about the neck and shoulders position. After the breathing sequence number 1, we perform the breathing sequence number 2. For this sequence, place your other hand over the lower chest, at the xiphoid process, and parallel to the first hand. This hand is very important because it's used during the exhalation, lowering the lower chest down. Also, in this phase, at the end of an exhalation, hold the breath for a count of 3. To recap, breathing sequence number 1, followed by period number 2. Then hold your breath for 3 seconds. 1, 2, 3, and inhale forceless. Another way to perform this is to place the hands by side at the lower chest, and try to bring the chest down by squeezing and move the hands down towards the navel. During this breathing, we should consider our chest as a bellows that during exhalation close themselves, tractioning all the extremities towards generating tensions, while during the inhalation, the bellows open and periphery release these tensions. After chest mobilization, it's time to work on the cervical tract with a self-traction. Place your hands behind your head with your fifth fingers on the occipital ridge and your thumbs on the mandibular condyle. Eyes gazing at ceiling. Perform a self-traction in axial direction. This traction will help lengthen the cervical spine, as well as stretch the muscles down into the mid-back area and decompress the cervical vertebrae. Be sure that your chin is not too lifted or too knotted and gaze at the ceiling. Keep the traction for few seconds, without loosening contact between your head and the floor, while always gazing at the ceiling, without nodding or lifting the chin up. After the self-cervical traction, we will focus on the hip. Hold your hands at the hip, by placing them on the iliac crest, and perform a gentle traction toward the wall. Don't rush during this phase, and try to maintain the traction for a few seconds, feeling a relief from the decompression of the last lumbar vertebrae. At this time, we can go back to our breathing, and place our hands back parallel to each other as described before. One hand on the sternum, and the other one on the lower chest for chest mobilization. All these processes must be performed with relaxed breathing. Remember that, if you have some issues with this procedure, you can place your hands by sides of your chest and squeezing with your hands moving down. Always, maintaining the posture as described before for the head cervical region, and the sacrum in contact with the floor. Remember, do not compensate with other positions. Do not stop the breathing with the breathing sequence routine. Don't arch too much your back. Don't extend too much the head and the neck. And most important, don't lose contact between the hip and the floor. Let's put tension on the inferior limbs, starting off with the gluteal muscles and pelvic-trochanteric muscles. To begin, flex the knees to put tension on the gluteal muscles, and until we notice that the sacrum loses contact with the floor. After, we adduct the knees as much as possible, work with the tensions by placing our hands outsides of the knees. Let's start the breathing sequence. 1, 2. With the sacrum touching the floor. In addition, during the breathing sequence, we must keep the head in contact with the floor and try not to go in hyperextension with the head cervical region. After every sigh, we push the knees against our hands. 1, 2, and 3. The pressure is performed with a low intensity, around 100 grams. The posture sequence can be done in two ways: knees flexed or adding more adduction on the knees. After working with the tensions on the gluteal and pelvic-trochanteric muscles, we put tension on the ischiocrural and popliteus muscles. In this scenario, the knees are extended. Stop this extension when you feel tension along the posterior leg. The sacrum is always in contact with the floor, and the head and neck in a good position, without losing contact with the floor. We stay in this position until we feel less tension along the posterior leg's muscles. Yet, we need to focus on the knees position that are neither outward nor inward but in a neutral position. When you won't feel any tension on the inferior limbs, you can move your legs into more extension, while maintain the sacrum and the head in contact with the floor. Our scope is to move the legs in full extension with the ischial tuberosity in contact with the wall, without losing contact between the sacrum and the floor. To achieve full muscle tension of the inferior limbs, we need to focus on the triceps surae, and, in preparation for this, first, we need to stretch the soleus. We can slightly flex the knees, while dorsiflexing the ankles, and to be sure that the toes don't extend, because they will put too much tension on the plantar feet, hollowing the foot out. We need to proceed as before. Breathing, while maintaining the sacrum and the nuchae in contact with the floor, with a good chest mobilization. Without losing the ankle's dorsiflexion, we can extend the knees. It's possible that during this procedure, we might feel tension on the ischiocrural muscles. For this reason, the sequence has to be very slow. Please note that, during this self-stretching, we don't want to feel pain, because it might cause some issues in maintaining the cervical and the lumbar region, in the position described before. At the end of the practice, move your knees into flexion, and roll to your side, and, after few seconds, stand up. During the performance of this self-posture, we can move our arms into adduction, palms up, long by our sides, or into full abduction, palms up. Also, in this scenario, we need to perform the breathing in a correct way, keeping contact between the lumbar with the floor, without extending the cervical region and the hip on the floor. Remember, don't rush between the phases. Take your time. The progress is slow, and when you breathe, try to do it naturally and deeply. The proprioception and contact of the limbs and the spine on the floor is very important. In addition, don't proceed with the posture if you feel pain. If the pain remains, contact your physical therapist.